Here is a patient's report by Dr. John, a renowned psychotherapist. The patient was referred for a psychiatric evaluation due to concerns regarding excessive mobile device usage and potential addiction. The patient's caregivers have observed a significant increase in screen time, resulting in negative consequences on the patient's well-being and functioning. The patient, Simon, is a 14-year-old child residing in Texas, US. According to the caregiver's report, the patient has been exhibiting signs of excessive mobile device usage over the past 7 to 8 months, spending on an average of 10 to 12 hours per day engaged with digital screens. This behavior has escalated in recent months, leading to concerns about potential addiction and its impact on the patient's physical, emotional, and social development. Here are my clinical observations. During the assessment, the patient displays signs consistent with mobile addiction, including preoccupation with mobile devices, often expressing distress when unable to access them, withdrawal symptoms such as irritability, anxiety, or agitation when restricted from using mobile devices, tolerance requiring increasing amounts of screen time to achieve the same level of satisfaction, continued use despite negative consequences on academic performance, interpersonal relationships, and daily functioning, loss of interest in previously enjoyed activities that do not involve digital screens, disrupted sleep patterns with prolonged screen time before bedtime, affecting the patient's ability to fall asleep and maintain restful sleep. These consequences of mobile addiction were shared with his parents. The excessive use of mobile devices has led to several adverse consequences of the patient, including number 1, impaired cognitive functioning. Prolonged screen time has been associated with deficits in attention, memory, and executive function, hindering the patient's academic performance and learning abilities. Number 2, social isolation. Excessive reliance on digital communication platforms has replaced face-to-face interactions, resulting in social withdrawal and difficulties in forming and maintaining meaningful relationships. Number 3, emotional dysregulation. The constant exposure to social media and online content has contributed to heightened stress, anxiety, and mood disturbances, exacerbating pre-existing emotional vulnerabilities. Number 4, physical health risks. Sedentary behavior associated with prolonged screen time increases the risk of obesity, musculoskeletal problems, and eye strain, compromising the patient's overall health and well-being. And number 5, sleep disturbances. The use of mobile devices before bedtime disrupts the patient's sleep-wake cycle, leading to insomnia, fatigue, and impaired daytime functioning. Nomophobia, or the fear of being without one's mobile phone, is a phenomenon increasingly recognized in individuals, particularly adolescents and young adults, who exhibit excessive reliance on their devices for social connection, validation, and entertainment. While not formally recognized as a psychiatric disorder, nomophobia shares similarities with other behavioral addictions and warrants attention in clinical practice. Here are the recommendations. Psychoeducation. Educate the patient and caregivers about the risks associated with excessive mobile device usage, including nomophobia, and provide guidance on healthy screen time habits and digital literacy. Cognitive behavioral therapy, CBT. Implement CBT techniques to address maladaptive thoughts and behaviors related to mobile addiction, such as setting boundaries, identifying triggers, and developing coping strategies to manage cravings and withdrawal symptoms. Family therapy. Engage the family in therapy sessions to foster open communication, establish clear rules and limits around screen time, and strengthen familial bonds through shared activities and quality time spent offline. Mindfulness and relaxation techniques. Introduce mindfulness-based interventions and relaxation exercises to help the patient cultivate present moment awareness, reduce stress, and enhance emotional regulation skills. Physical activity and hobbies. Encourage the patient to engage in regular physical activity and pursue hobbies and interests that do not involve screens, promoting a balanced lifestyle and opportunities for social engagement and personal growth. Follow-up and monitoring. This is what I have suggested. Regular Follow-up appointments are recommended to assess the patient's progress, address any challenges or setbacks encountered during treatment, and modify interventions as needed to support long-term recovery and well-being. Collaboration with other healthcare professionals, including educators and pediatricians, may be beneficial in coordinating care and implementing comprehensive interventions to address mobile addiction in children. In conclusion, mobile addiction poses significant challenges to children's mental health and functioning, impacting various domains of their lives. Through a multidisciplinary approach incorporating psychoeducation, therapy, and lifestyle modifications, interventions can be tailored to address the underlying factors contributing to mobile addiction and support the patient in achieving a healthier relationship with technology. This report is based on clinical observations and recommendations and should not replace individualized assessment and treatment by qualified mental health professionals. The patient's privacy and confidentiality have been maintained throughout the report.